fitness assessment and evaluation. We use the word fitness because it's got the health aspect, it's got the performance aspect. Under performance, we've got sports, we've got exercise training. Nutrition and dieting are subsets within the two aspects of health and performance. However, we should be cognizant of the fact that this dieting and nutrition can be looked at as a standalone profession based on the advances in research and development. At the Fitness and Health Assessment Center, we look at the human body as a complete organism in which all systems work together to achieve a specific outcome. By systems, we're looking at your psyche, that's psychology, your physiology, your kinesiology. In the United Kingdom, we call that your biomechanics, and your physical processes. This fitness assessment and evaluation is what accurately determines how you commence and the trajectory of your exercise training involvement, because it gives purpose, which purpose refers to goals or goal setting, which is related to motivation. You can refer to this subject of motivation and goals from our earlier video. With the fitness assessment and evaluation forming the bedrock of all our programmings at the Fitness and Health Assessment Center, it is carried out within 2 sessions, which are preferably spread over 2 days for purposes of recovery. And what we look at during these 2 sessions is determining your body composition, your cardiovascular fitness, and your movement efficiency. Under body composition, we're concerned about determining your fat mass, your lean body mass in relation to your fat mass, and determining your body type. One of my gold standard publications that ushered me into this field is in the Journal of Sports Sciences 2002, authored by Roger G. Eston. The BMI, that's the body mass index, determined him to be rather grade 1 obese, that's overweight. But the fat-free mass index determined him to be rather distinctly muscular, and his body type was dominantly mesomorph. In other countries, like in Japan, the body mass index is adjusted to suit their demographics. So this shows that body mass index is not necessarily that accurate. Use it as a pointer to kickstart the process of body composition assessment. What we're rather engaged with wholly is skin anthropometry. And here we determine your body composition components, that is your fat mass, your lean body mass, using skin folds, muscle circumference, and bone breadths. And for determining your body type, we use the Heath-Carter somatotyping approach. Now let's be clear, your body requires an amount of fat to function optimally. Our concern is the excess fat that the body would accumulate, which we would term as dead weight, which predisposes you to a variety of disease and disabilities like type 2 diabetes, hypertension, obesity, a variety of cardiovascular disease, types of cancers, arthritis, renal disease, and liver disease. For your lean body mass, this is your active body tissue. It involves your muscle and bone. This is assessed in relation to your body fat mass. And finally, we determine your body type by classifying you as either dominantly endomorph, dominantly mesomorph, or dominantly ectomorph. Endomorph basically refers to your relative thinness. Mesomorph refers to your relative muscularity. Ectomorph refers to your relative fatness. And under your cardiovascular fitness, we look at the functionality of your heart, your blood, and your blood vessels. We go a step further to look at blood as an organ as opposed to a tissue in the conventional sense for functional reasons. And this usually goes steps further into determining your volume of oxygen consumption and, if necessitated, your blood lactate thresholds. And lastly, we look at your movement efficiency. This we carry out using video analysis, and what we're concerned about is determining your bilateral deficits. The aspects that we look out for depending on the ecological validity of the scenario are your body angular velocities, your body segment angles during a specific segment of the motion. It is important to correct any movement deficiencies in terms of bilateral deficits to save you from lost time due to injury and also to save you from blunting out any training progressions due to improper movement technique. Stay tuned to our next session of fitness assessment and evaluation, where we'll be looking at considering the aspects of your history of physical activity and how it plays out in the entirety of the fitness assessment and evaluation. See you next time.